name is David Neil Franz, and I'm a professor of neurology and pediatrics at the University of Cincinnati and Cincinnati Children's Hospital in the USA. I've been involved with tuberous sclerosis formally since 1992. That's when I started the tuberous sclerosis clinic at Cincinnati Children's Hospital. Well, I'm a neurologist, so my special interest is the neurological problems that children and adults with tuberous sclerosis have. At our clinic, we take care of people of all ages, so we don't just see children or just see adults. But the primary problem people with tuberous sclerosis face are related to issues with the brain, whether they're severe ones like autism, cognitive impairment, seizures, or fits that can be very difficult to control. Even people that have tuberous sclerosis that have normal intelligence sometimes have learning or social or psychiatric problems that, because of their specific problem, can be different than anyone else in the population that, say, has epilepsy or a psychiatric condition or learning problems that doesn't have tuberous sclerosis. So that's really my primary thing, is issues related to the brain. Well, in 1992, when the clinic began, very little was known about tuberous sclerosis. For example, we didn't know what the genes were. We didn't know anything about how people got it or what was wrong with the genes to cause people to have it. We knew that it caused growths in different parts of a person's body, that you got tumors and white spots on your skin, and that it could be passed from parent to child in some cases, and that many of the patients had severe cognitive problems, autism, seizures, but there was basically little known about what really caused it. And since 1992, there's been an incredible amount of progress. The genes have been identified, what the genes, the proteins the genes create or are responsible for have been identified, and we know very precisely why people get tuberous sclerosis, and that's then allowed us to develop different ways to screen for the problems that are part of the disease and to develop new treatments for it. Research has shown that the tuberous sclerosis genes work to control a protein in the body called mTOR. That stands for the mammalian target of rapamycin. In patients with tuberous sclerosis, this protein mTOR is too active. And by being too active, that causes the growths of malformations in different parts of the body, including the brain, lungs, heart, and kidney. There are drugs that inhibit mTOR, and these drugs have been shown to be effective for many of the problems associated with tuberous sclerosis. One of the problems with these medicines is that they only work as long as you take them, as is the case, for example, for medicines for blood pressure, diabetes, or things like that. These medicines can shrink the tumors and preserve the kidney function that's often lost in tuberous sclerosis. We found evidence they can help with seizures, with learning and behavior. They can reduce the tumors on the face and on the hands and other parts of the body that are often very disfiguring and cause a lot of problems with people with tuberous sclerosis. Some of the challenges are that these medicines have side effects. They can cause mouth sores, they can increase your resistance, or decrease rather, your resistance to infections. They can sometimes cause your blood cholesterol to go up. These are all things that can be managed, and they can be reversed by stopping the medicine, or in some cases by reducing the dose. So a real focus now is to find the right time to start these medicines, the correct dose to give to avoid side effects, and determining how long you actually need to have patients treated with. mTOR inhibitors really revolutionized the treatment of tuberous sclerosis, at least in my opinion. Before mTOR inhibitors were available, if you had a person with tuberous sclerosis that had epilepsy or had a brain tumor or had bleeding in the kidney or had facial tumors, the only treatment options were those that would be available for anyone else. So you could do surgery to remove tumors from the face or from the brain or the kidney. You could use seizure medicines like you would for anyone else, which often were not effective. What mTOR inhibitors have enabled us to do is to have a treatment that's specific to the genetic problem in tuberous sclerosis. So it's like a diabetic who doesn't produce insulin taking insulin that then corrects the underlying problem, at least in the short term. So it specifically targets the genetic abnormality that affects every cell in a person with tuberous sclerosis, that every cell in a person with tuberous sclerosis has in their body. You may start it for a brain tumor or a kidney tumor or intractable epilepsy, and that may be the primary thing that you're worried about when you start it, but it will help every aspect of the disease that person tends to have. So if they have epilepsy and kidney tumors, both will be improved, or if they have facial tumors, that will be improved as well. So it's really a comprehensive treatment, and it's really enabled us to offer a lot more to patients than we could before we knew about this.